Hello, my lovely viewers. How are you doing? I am back to you after a gap of 3 months with a bang to my Prankhola podcast series. And today we have with us Dr. Aditya Sai, who is a practicing orthopedic surgeon practicing in Mumbai at Dr. L.A. Chiranandani Hospital, Mumbai. Dr. Aditya Sai is an orthopedic surgeon whose expertise is shoulder and knee injuries and sports injuries. So, welcome, Dr. Aditya, to
Thank
my
you.
channel,
Thank
Life
you for having
Unscripted
me.
with
It's a
Arpita.
very wonderful thing that you invited me. I'm very grateful to you. Thank you.
We are very delighted to have you. So, my lovely viewers, please stay with us because you are going to be loaded with a lot of information about our joints, muscles, and sports injuries from Dr. Aditya. So, Dr. Aditya, my first question to you would be why orthopedics? And after orthopedics, also, why knee and shoulder specialization and sports specialization?
Okay. So that's a very nice question. See, I was quite interested in physics when actually I was studying.
Right.
And I also was interested in biology. So when I wanted to pursue medicine, I thought I'll take up a specialty which has a lot of involvement of physics in that. And orthopedics is a specialty where every repair, whether it's a fracture surgery, whether it's a ligament repair surgery, a lot of physics is involved into that. Second thing, what I realized was I wanted to improve the quality of life of individuals. So, I mean, as a doctor, there are two types of, people, doctors. So, one is the physicians or intensive care unit people who are actually saving life, making a difference. But then there are other people like orthopedic surgeons. So we do procedures or things which improve the quality of life. Let's say somebody is having a lot of knee pain, he is not able to run or do any of those things, his quality of life is compromised. Or somebody with a shoulder pain may not be able to sleep in the night, and
Yes.
you have a lot of disability with that. So I always wanted to improve the quality of life or individuals, and that was my driving force. And I think we should always try to make a positive impact to individuals, and get them back to their level of activity. The shoulder as a joint always fascinated me, how it works, how people recover, and that is something that drew me towards it. And the procedures where we can preserve the natural shoulder function and restore the mobility, those were things which were very interesting when I was studying orthopedics. So that is what drew me towards that.
Right. And Dr. 30 years ago, we used to hear about only one term, orthopedic surgeon. But
Yes,
these days, there are so many specialization. So, is
correct.
it actually required, this kind of specialization within orthopedic, like in every discipline? Super specialization. Is it
Yes.
actually required? What do you think?
So that's a very interesting thought. So see, the thing is, if you look at 50 years back,
Yeah.
um, every surgical specialty used to come under general surgery. So even if there was a neurosurgeon, he was a general surgeon who used to practice neurosurgery. And even if it was an orthopedic surgeon, actually he was a general surgeon who was practicing orthopedics. Now from 1980s, actually the specialization of orthopedics started and it got divided away from general surgery. And as you study and as you treat more and more people, you understand that there are a lot of intricacies in each subspecialty. So if you look at the amount of work that is in the shoulder, the amount of literature that is in the shoulder, or for that matter any joint, like you have so many specialties in orthopedics, like spine surgery, pediatric, orthopedic oncology, joint replacement surgery. So there is so much volume of literature, so much experience to be had, to treat these problems properly. So there was studies that showed, somebody who is an orthopedic surgeon treating a shoulder issue versus a shoulder surgeon treating a shoulder issue versus a sports injury specialist treating a shoulder issue. So the best results were with a joint specific doctor. So the thing is, we keep on treating the same problem over and over again in different group of individuals, and then we have our algorithms on how to treat these things for optimum outcome. So that is what improves patient outcomes at the end of the day. Um, it's very, very difficult for one person to excel in everything. So somebody, like you, I mean, people who have kids and all, some kids may be good in math, somebody may be very good in biology, but you will rarely find somebody who is equally good in everything. So similarly, when you look at treating people also, some people are good shoulder specialists, some people are good knee surgeons, and that is they keep on treating those things to improve their outcomes and good results for their patients. So it is definitely a positive change for patient care in the long run. It helps in giving you the optimum outcome. Yes, there is a contrary thought that you may feel that we are dividing up the body into so many things and we are not treating the patient as a whole being, but these subdivisions lead to better improvements in those issues, and you can function better with that.
Right. So, doctor, if some patient come to you with a rib injury or spine injury, then would you refer him to spine specialist or rib specialist, whatever? You won't treat him.
So see, there are two parts of this. Somebody who comes in an emergency, who is in acute pain, as a doctor, it is our responsibility to treat them. But once the acute management is taken care of, and the individual is, okay, then yes, ideally he should be treated by a specialist of that particular field,
Right.
because that will give him
But
a better
doctor,
result.
okay. Right. But doctor, you are sports injury specialist also. And
Yes,
sports injury can happen to any part of the body. So
correct, correct.
let me explain this. Like you are shoulder and knee expert, but you are sports injury expert also. So
Correct.
how we correlate?
So, see, what happens is you're 100% correct with your question. So, if you, let's say, have a sports injury, when we look at that, it's a very, very broad term. So, sports injuries, there are a lot of people who come into treating that. So if you look at football, one of the most common footballing injuries is concussion. Concussion is somebody, they do a header and there is, the brain shakes up inside and they feel dizzy and may lose consciousness. So that is one of the most frequent footballing injuries. Now, as a sports injury specialist, those things come to us initially, but at the end of the day, they are referred to a neurologist or a neurosurgeon to manage the problem. Similarly, somebody who is lifting a heavy weight, not in the correct posture, and has a back injury in the gym, so then it is treated by the back specialist. So we act as a gateway to the correct person. So there are so many specialities. Somebody who has, let's say, twisting injury to the ankle, or who has a chronic ankle or a foot issue, there are foot and ankle specialists for that. So yes,
Okay.
initially for a primary treatment, these individuals may come to a sports injury specialist when they have the injury, but finally, if the sports injury specialist, let's say he specializes in shoulder and knee issues, he will treat those selective issues, and the rest is referred to his team. So it's more about a team approach to the injury rather than one single person treating everything. So in a dedicated team, there are different
Okay.
individuals. Yes, so it's more of a team approach to treatment rather than anything. So when you look at treatment of sports injuries, in the team there is a neurologist, there is a general surgeon, because another thing which you commonly see is hernias
Okay.
happening in people who
Yes.
are lifting weights. Then
Right.
you have foot and ankle specialists. You have pediatric specialists who treat, injuries in children who are skeletally not mature. Then you have spine specialists who treat back related issues. So it's about giving the individual a better treatment with a team approach so that they have a better result. You have sports nutritionists looking at that, sports psychologists looking at, see what happens. A lot of times people have this injury, they may undergo some surgery. And in athletes who are high demand athletes, like playing for the country and everything, their fear comes inside that whether I'll be able to play again. And that fear actually can bog a lot of people down. So you have these sports psychologists also who can, reinforce that confidence in them that yes, you can go ahead and do it. So it's a whole new approach of a team approach to treating an individual.
Okay, okay. Like in sports injury also, there are specialization. And that's why,
Yes,
like, we are reading in newspaper this time with the Olympic gym of India, there was a psychiatrist, I think, for the first time.
correct, correct. So that's very important to motivate people that they can come out of the injury, or if they have had a bad day, that they can get back again there on the mat and give a
Hmm.
100%.
Right, right. So, doctor, what is the most common problem with which people come to you?
Right.
Ah,
So actually, if you see the most common problem which people come to me, if you look at the shoulder in younger individuals, the most common problem which we see is somebody who is dislocating their shoulder. So they have some ligament tear in the shoulder and they are dislocating it frequently. Once we cross the age of 45, 50, then we start getting individuals who have shoulder pain, rotator cuff issues, or frozen shoulder for that matter. Then when you look at the knee joint, we have people who have had injuries to the ligaments in the knee joint or to the cartilage in the knee joint. These are the people. But by far, the most common sports injury you get actually is tendinitis or tendon inflammation. So it can happen in the knee, it can happen in the shoulder, around the ankle. So
okay.
tendon inflammation, as such, is the most common thing people come for.
Ah,
Because and what happens is a lot of times people start exercising, they don't warm up properly, and if you look at our traditional concept of exercise, people will tell you that okay, I go for a walk every day in the morning, but out of 10 people, maybe only 3 will tell you that they go to the gym also. So the concept of strength training traditionally is a bit deficient, and it's because of these deficiency of strength training people start developing these issues. So yeah, tendinitis probably is the most common thing people come with.
okay. So, so you are saying is strength training is very much essential for everybody, right?
Correct, correct, 100%.
Okay, okay. And
And
doctor, what? Tell me.
yeah, and regardless of age or gender.
Hmm.
So, I mean, for example, I'll tell you my own wife, she was initially very apprehensive about strength training. She was like, I will become boyish with muscles and everything. But that concept that in women that, they'll develop big muscles and everything is wrong actually. Strength training is very important for them also because they are not going to bulk up with strength training, rather, they will become more toned and more fit. Second thing is strength training is very, very important for your joint nutrition and bone. If you ask me, the single most important thing which you can do to prevent joint pains as you age is strength training. Because how your body works is if something is in use, if it is used regularly, then there is more blood flow, there is more nutrition going to that area, and that area stays stronger. So, if we see people who are going to gym regularly and obviously doing other cardio forms of exercise, their bones are very, very good. They are very, very less likely to have these osteoporosis or fractures due to fall. Whereas you compare that to people who are more sedentary, who are generally lacking in exercise, they have weaker bones. So that's the most important thing you can actually do to keep yourself fit. and regardless of age. See, when we talk about strength training, people typically associate it with, going to the gym and pulling heavy weights and all those things. That's not required. We are not competing in some competition. We are looking at basic strength training, basic resistance training to improve our tone, our muscle bulk. That's it. And that is what people need to keep in mind when they go there.
Right. And these days, information is very easily available. The social media.
Yes, yes, yes,
That also
definitely.
helps. Right. And doctor, what is the difference between a muscle injury and a bone injury? Like how you treat them differently. Like if you
Yeah.
please explain for my viewers.
Yeah, yeah, sure, 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 definitely. So, see, when we look at bone injury, when we look at muscle injury, and the second group is obviously tendon injury and ligament injuries. All right. So, we need to understand there are two parts of a muscle. One is the muscle belly, which has muscle fibers. It forms a structure known as tendon, which goes into the bone and inserts there. So, the muscle actually has a very good blood supply, it heals very well. And generally, muscle injuries, typically, even muscle tears for that matter, they can heal over a period of time on their own. But then, when we look at tendon injuries, tendons are elastic structures. Once they tear, they retract. Their blood supply is also poorer. So these are the things that don't heal on their own. So the healing potential, if you see, of tendon is lowest compared to anything else. So bone has a good healing potential, muscle has a good healing potential. Some ligaments which are outside the joint, they have a good healing potential. But tendons have the very poor healing potential, as well as ligaments which are inside the joint. So we need to treat these injuries more aggressively compared to, let's say, a muscle injury. Fractures, as such, again are having a good healing potential. The bone has a good blood supply. The what happens with fractures is there is a displacement associated with some fractures. When we talk about fractures which are not something like a hairline fracture, okay. So when we address these things, whether it is through a surgical treatment or through a non-surgical treatment, it is about getting the correct alignment of the bone to ensure that it heals in the correct place. So once the alignment is corrected, generally the bone heals quite well, and then it becomes a question of whether we want to start early function for the individual. So in those scenarios we consider a surgery, and if like certain fractures like you have of the wrist where actually there's not a lot of compromise in function, people can manage themselves, we generally put a plaster. So it depends on what alignment we get and how early we are able to restore the function with regards to fractures.
Right. And doctor, could you please explain what is the difference between arthroscopy and major invasive procedures?
Yes, yes. So, arthroscopy essentially what a lot of people call as a keyhole surgery. In a lot of people also call it a laser surgery. As such, there is no laser in orthopedics. So, people in a local language call it laser surgery also. So, it's a keyhole surgery essentially. And essentially, what we do is we use a very small camera to look inside the joint. It's a very high definition camera where which we can visualize the injured structures in the joint and repair it. So, arthroscopy essentially is a form of a minimally invasive surgery. The advantage it offers is since the cuts are small, there is a very low risk of infection. The tissue dissection is also lesser. So post-operative pain is also less. A lot of times people are, discharged the same day or the next day of the procedure, and it improves patient safety also and provides better patient outcomes. So arthroscopy essentially is a very, very specialized form of a minimally invasive surgery. Now, when we look at a minimally invasive surgery, as I said, it can be an arthroscopy or a surgery done through a small cut around your joint. So, a lot of times, a surgery like a knee replacement also can be done through a minimally invasive procedure to cause lesser damage where the cut size is very small. Even for that matter, a shoulder replacement can be done through very small cuts around the shoulder. But these are again at the end of the day open surgeries. So minimally invasive surgery can be an open surgery also, as well as an arthroscopic surgery. It's
So
just a
is there,
broader term.
okay. So is there any percentage these days, like most of the surgeries are these days keyhole surgery type or major invasive type? Like some data is
So
there.
yeah, yeah, definitely. So, see, if you look at my practice, I would say that 90% of my surgery are arthroscopic surgeries because I'm a arthroscopy surgeon and I specialize in that. When we look at shoulder replacements, which we do, then they are open or minimally invasive procedures. So that constitutes around 10% of our work. Now, if you compare that to somebody who's not a arthroscopy surgeon, they will be doing 100% of the work through the open surgery. So nothing wrong on that. The procedures probably which they do are different, which are not cannot be done arthroscopically. For example, certain fractures cannot be fixed arthroscopically, like joint replacements cannot be done arthroscopically. So if you look at the work of an arthroscopy surgeon, it will be 90% minimal arthroscopy and maybe 10% for certain procedures, it will be a
Okay.
open surgery.
Right, right. And okay, doctor, can you advise us three simple rules at different stages of our life, like in 20s, 30s, in 40s, 50s, and 60s and above, to keep our bones and muscles healthy? Three
All
simple
right.
rules.
Yeah, yes. Three simple rules definitely I will advise you, and I'll make it more easier for you. I'll break down the age differences into shorter gaps so it's easy for
Okay.
remember. See, below 40, your body
Ah,
is fit. It can take whatever you throw at it, but that doesn't mean you abuse your body. So, have very important at any point of time is have healthy food. So, the concept of eating out actually not such a good idea. Homemade food which is fresh, that is the best variety of food you can have. um, the diet choice obviously is up to you. Have good amount of protein in your food typically, which is twice your body weight. I mean, so if your body weight is around 60 kilos, have 120 grams of protein, provided that you don't have any kidney issues or something like that, kidney or liver issues. So those are the exclusions to that. Second thing is, um, people below 40, they're working quite hard and the sleep wake cycle, gets really disturbed. People tend to sleep quite late, maybe around 2 3 sometimes in the night, and wake up late. Try to avoid that kind of a thing. Try to wake up early, do some exercise in the morning and start your day. You will feel, you will, initial 12 days it will be difficult for you, but after that you will realize that, if you get up early and you get the first mover advantage, you are always ahead of the day. If you wake up
yes,
late, then you're always trying to catch up with the day.
yes,
So
yes,
that's a very important habit, and the earlier you can inculcate it, even in your kids, the it easier it will become for them as well as you. That's one of the most important habits. Third thing is, exercise regularly, and that's something I tell everybody, regardless of the age, that um, they should do a combination of some resistance training and some form of cardio. A lot of people consider yoga also to be a form of strength training, which it is not. It is essentially, yoga is an exercise to improve your energy flow. So that was the whole concept with which yoga was brought out, and it is a good form of exercise, but it's not a substitute for strength training. So you should do strength training, yoga, cardio, all in a combination, and everything is good. Once you cross 40, your body probably will not be the same thing it was before that. So, things like weight loss and keeping yourself, now it becomes a challenge. So it's even more important that you have a good look at your diet, what you're having, put in food in your body which is good for you rather than junk food. Very, very important. And have regular eating habits. Don't compromise on that regardless of how busy you are. If you are sorry exercising or doing something like that, then don't abuse your body. So you have nowadays gyms and fitness institutions coming up with activities like high intensity training, interval training, and jumps and all those fancy stuff. See, we need to understand these are not exercises which are designed for 40 plus people. They are for young athletes who are 25 years of age. So if you do things which are not age appropriate, you will end up with injuries. So it's very, very important to pick and choose what you're doing rather than doing some stuff randomly, which probably the instructor told you or which is in their manual. So you have to see your age and do those things. Now, as you start crossing 60, it's
Yeah.
important to keep these things in all these advices which I have told you in mind. And by that time, obviously, you will be more wiser than me to, actually
Yeah.
follow those things. So, but the most important thing which we feel with people above 60 is that their bones are weak and with small, small falls, they can have fractures. So, the most important advice I would like to say for them is when you sleep in the night, keep a night light. The washroom should be dry so that you don't slip and fall when you get up in the night. Majority of the falls in elderly are at home with which they have fractures, and those fractures can really affect the quality of life. At home, in stairways as well as in the washroom, you should have railings which people can grab onto in case they fall, so that they don't have leg fractures, which can be really a bad thing to happen in that age group. So obviously, the other advices are still in place, but this is something very, very specific for elderly people.
And doctor, tell me one thing. Is joint pain is a part of aging? Like as we age, is it that we are going to have some sort of joint pain somewhere or the other, or it can be prevented?
Yes, so see, you should not have joint pain with age. Yes, as you age, there will be some amount of wear and tear in your body.
Hmm.
There are multifactorial things like some people have genetic issues, some people weight issues are there, some people have injuries in the joints which cause these things. But as such, yes, I see a lot of people who are 75, 80 years of age also without any joint pain. So it's not natural for you to have joint pain. Yes, some amount of wear and tear will be there. But if you keep exercising, if you keep yourself fit, if you have the right food, then these issues to a large extent can be prevented. So I would say that it should be a combination of a regular exercise to keep your joints in shape, good food, and um, managing the weight. Uh,
Keep your weights within limits.
yes, that is very important. So see,
That
I
is very
mean, I'm there is a lot of people aim to have a very slim figure and all that. That is not what I'm talking about. See, every body has a weight. So there are three body types: ectomorph, mesomorph. So somebody who is very thin is an ectomorph. So you cannot bulk him up and make it him heavy. Similarly, a person who is slightly on the plumper side, there is nothing wrong with that weight. What I'm saying is it should be within a desirable range. That person will not become a very thin person over a period of time, and that should never be the goal also, because the
बॉडी
moment you
मास
stop.
इंडेक्स फॉलो करना चाहिए.
Correct.
बॉडी मास
So
इंडेक्स का जो
yes,
लेवल है. हाँ.
yes. So your ideally you should have more muscle mass than fat. That is important, and that will help you.
Yeah.
So also an important point which I'm trying to make here is that don't chase that size zero figure. That doesn't help anybody. What I'm trying to say is there you have a body type, there is an ideal weight range for that. Just stick within that, because even if you, let's say, do something, go on a crash diet and get to that weight, once you leave that diet you'll again bounce back to that, because your body is like that. You cannot change it to become a very thin person.
Yeah.
Similarly, a very thin person cannot become a obese person, because his body type is going to be like that only. So that was my point. Keep it within the ideal range and try to maintain a good muscle mass. That's very important,
Right.
right? So that exercise and good healthy lifestyle habits should prevent a lot of extent these joint pains. Third thing is, when you have injuries, do address them at an appropriate time. It is very important, because I'll give you an example of the knee. So, certain recreational athletes essentially means they are not playing professionally. They may play on the weekends, have some injury in the knee, a ligament injury, or let's say a meniscus injury inside the knee joint. So, which requires probably a surgical treatment. But a lot of times people are afraid of surgery, which is natural. But what happens is, if they don't treat that problem inside, they don't structurally restore the normal knee function, over a period of 15-20 years, the knee wears out, and then you have pain, and that is where we can't do a reparative procedure. So that part is already left behind. So if had we addressed this early, you might not have got that later. So it's very simple concept. Be active. If you have injuries, treat them appropriately so that you don't have long-term issues.
Right.
Right?
Yeah. Achha, is there any alternative for knee replacement surgery, which has become very common these days?
Yes.
Alternative in the sense, can it be delayed for some time by some alternative treatments?
Right. So,
Ah,
see, very important to understand, knee replacement surgery is a surgery which no surgeon can advise to you. It is essentially a patient should ask for that. That, okay, I am having so much pain that I am not able to manage, and
okay.
henceforth I would like to consider this surgery,
Hmm.
because any orthopedic surgery for that matter, everything is an elective procedure. There is nothing compulsory that you have to do. So, if it is affecting your quality of life, if you are having pain, if you are used to doing certain things which you are not able to, then you should consider a surgery. So, when we look at knee replacement, it is done for arthritis of the knee joint, right? So, arthritis typically where the knee is fully involved. So when you look at the knee joint, it has three compartments. One, the inner compartment or the medial compartment. One is the outer compartment, and one is the one behind your kneecap. So the patellofemoral compartment. So typically a knee replacement is done for tricompartmental arthritis of the knee joint. Until date, it is the best intervention to treat a significant tricompartmental arthritis of the knee. So there is no doubt about it.
Hmm.
And for that same reason, that surgery is also very common. Now, if somebody is younger, let's say around the age of 50, they have arthritis located only to one area of the knee joint, then it can be managed through procedures which preserve the joint, like a high tibial osteotomy. So these are joint preserving procedures which will,
Ah,
enhance the quality of life and improve the longevity of the knee joint. These are
okay.
not procedures, although, that can be done in more elderly individuals or with more advanced arthritis of the joint. Now, the algorithm which we look at is essentially somebody who has tried weight loss, who has done physiotherapy, even taken injections in the knee. So these are all non-surgical treatment options. Weight loss, improving the strength around your knee, physiotherapy, and probably injections in the knee joint, which can be done in early arthritis of the knee, which can delay the knee replacement.
Right.
But the activity should be preserved. So somebody who is used to walking for 5 kilometers should be able to walk for 5 kilometers with all these treatment options. And if they are able to do that, then there is no need for any intervention. But
Okay.
what happens is if your 5 kilometers has become 2 kilometers despite doing weight loss or physiotherapy or injections in the knee joint, that means the treatment is not working. Then you can go to the next level of treatment, which is a knee replacement surgery.
So it is advisable for all people who are having knee problem or knee pain also, like to walk about 5 kilometers every day. It's
That
fine.
is just an example. I mean, it can be 5, 10 kilometers, but the point
Okay.
is point is that if activity is getting restricted, you have tried the non-surgical treatments, it has not working, then yes, it's a good option.
Right.
See,
Dr. Aditya, yeah, can you tell us some developments in the field of orthopedic surgery in last 10 years? And I'd like to mention one thing. These days we are hearing another new transplant, shoulder
yeah,
transplant.
yeah, yeah.
Shoulder replacement, like how it can be. I think use the word transplant. It is wrong. I think shoulder replacement is should be the word. And
Yes,
how like
yes.
shoulder is such a big like portion. It is replaced part by part or as a whole. Please tell us.
Sure, sure. Now, coming back to your question, so there are a lot of exciting things happening in orthopedics nowadays. Um, First, I'll talk about regenerative therapy, and then I'll talk about something newer, which is the shoulder replacement. So, um, younger people who have cartilage issues, which can end up in knee arthritis, nowadays we have procedures by which we can regenerate the cartilage, and that is the future of orthopedics. So, I'm talking maybe 20 years, 30 years from now, you would actually see with more public awareness, early intervention to the problem, you will actually see the knee replacement surgery as such declining. Why? Because I'll give you an example. Somebody has high cholesterol, they get cardiac heart issues, they probably get MI and they put stents and all those things, correct? That is the natural progression of a disease, right? So if let's say the cholesterol was addressed early with medicines, cholesterol was not high,
Hmm.
then he person probably would not have had heart problem later on. Same way, if awareness in public is more, if you have cartilage issues in the knee, let's say, or the shoulder, we do procedure by which we can repair the cartilage or make it normal. There is very less likely chance that later on you will develop arthritis and need to undergo knee replacement. So this is the role of a biological therapy or a regenerative therapy, that there are procedures now by which we can repair the cartilage, we can address the structures in the joint in such a way that they heal normally, and in the long term you don't get issues. So that is where procedures like autologous chondrocyte implantation, bone marrow implantation, and all those things have really helped us give better results to our patients. Then um, shoulder is an area where a lot of exciting work has happened. So a lot of times people used to have big tendon tears which were difficult to repair. So nowadays we are doing biological therapy there with patches which can improve the healing of the rotator cuff, which can help these individuals who have these big tears of the rotator cuff recover faster and more reliably. There are sometimes the rotator cuffs are so tears are so old that the total muscle gets wasted, completely gets replaced with fat. So nowadays we have procedures by which we can, shift muscles from some other part of the body to
Okay.
these areas and enable the individual to get a good movement. So a lot of exciting things are happening. The
Ah,
other important thing that is there is shoulder replacement. So people have heard about knee replacement, but shoulder is another equally important joint,
ah,
and the number of shoulder replacements is also increasing, and we have better techniques now. We have better procedures by which we can give better results to our patients. So typically shoulder replacements are done in people who have quite old, typically 65, 70 plus, who have big tears of muscles around the shoulder which cannot be repaired, or who have developed arthritis of the shoulder. And with these varieties of replacements, we can give a faster mobility to the individuals. We can customize, the implant and the way we put the implant inside. So probably for the knee, you have a robotic surgery. Similarly, for the shoulder, we have custom made implants as well as the cutting guides with which we put the implants. So all that can be planned and put inside the shoulder to give an individual a better result. So a lot of things are happening.
okay. And tell us something about the robotic surgery, like how robotic surgery help the patient as well as the doctors. And how can a robot be superior to someone like Dr. Aditya, such a smart, young, professional doctor? So
So
that is, yeah, please tell
well,
us.
that's a very interesting question in these times where there is a lot of thing about robotic surgery. So nobody needs to be superior. Both of them can be friends also and give a good result to the patient. So see, the thing is, at the end of the day,
Ah,
when we look at robotic surgery in
ah,
orthopedics, the robot is only there for a part of the procedure. So if you look at a knee replacement, the way
okay.
the bone is cut, that part only is directed by the robot. Rest everything is done by the surgeon. Even the data that is fed into the robot is fed by the surgeon. So it just gives an accurate cut, that's all. So that is
It's
the role
just
for
a
the robot.
helping tool, basically, right?
Correct. Right. So
It is
you
not
should
to
take.
replace the doctor.
Not at all. And even
Okay.
in more advanced surgeries, in cancer surgeries and everything, it's essentially the surgeon who is using who is operating the robot to, give a better result to the patient. So it is just a human operated thing which is giving more accuracy to your surgery. That's all. So both can work in cohesion and give a better result to the patient.
Right.
Yes, definitely
And
it is better. There is no doubt about it. But yeah, that adds up cost to the surgery and everything. That's all.
okay. So, when should someone choose surgery over physiotherapy for shoulder and knee joints?
Yeah, that's a very nice question.
Huh.
So let's say somebody is having a shoulder pain for 1 week, 10 days or something. He should not actually directly visit a surgeon or an orthopedic surgeon. They should first meet a physiotherapist. First, they should try physiotherapy. If your symptoms are improving, it is well and good. If your symptoms are not improving, if you are having a significant issue in the shoulder for a few months, then there is a point for meeting a surgeon for that. Because when we see a lot, see when we see shoulder pain coming to the clinic, 90% of shoulder pain would be tendon inflammation, posture related, and which actually will get corrected with physiotherapy. So yes, there is in the Western setup. What you have is when somebody has these issues, they first visit their physician or a physiotherapist and they try the rehab for a period of time. Only if things don't improve, then they visit a surgeon. Because if you directly visit a surgeon, they will only advise physiotherapy for you, which you could have got directly. Problems where there is a structural issue in the shoulder, problems where you have tried physiotherapy for few months, things have not improved, where your movement is not improving, your pain is not improving, or for instances where you fell down and then you couldn't move your shoulder at all, or you were initially able to move and then the movement gradually stopped. So these are the things where actually you should meet a surgeon to see why things are not improving, or if you're not after an injury suddenly able to move your shoulder.
Right. Okay. So, for desk job workers, like I'm also a desk job worker. I sit at the desk for 8 to 9 hours a day doing something in computer. So, for us, how we can avoid these joint pain issues, joint issues?
Yes, yes. So that's very become common nowadays. It's very
Yeah.
common. A lot of times people will have pain in this region, they'll have pain in the back, and that's just an occupational hazard. So very important that when you sit and work, your monitor should come at your eye level. You have to sit straight and work. You cannot sit like this and work. You cannot hunch forward and work. The other culprit is the mobile phone, because 50% of the work people do on their
Yeah.
mobiles, so their neck is constantly strained down, so that creates all sorts of issues. So your work posture is very important. Every half an hour you should try and get up and moving around, so that will relax your back.
Right. Yeah.
You should stretch yourself every few hours. So generally these things will improve your efficiency as well as prevent these joint related issues.
So, doctor, what I do, every 1 hour, what I do, I get up from my seat and I go to the area where drinking water is there and I drink a glass of water. So this
Yes.
way I drink a lot of water throughout the day and I walk also.
So you are killing two birds with one stone then.
Yeah.
You're drinking, staying adequately hydrated, as well as you're making sure that you don't have any joint related issues. That's very clever.
Doctor, where do you see yourself and this orthopedic care after 10 years from now?
So that's actually probably the most difficult question you have asked today. So um, it. I mean, obviously, I'm very happy with where life takes me. But yes, I mean, I would like to do more pioneering work in the field of shoulder surgery and sports injuries. Um, we would be, one of the most pioneering centers in Mumbai and Western India for shoulder procedures, and that is where I see myself. But to be honest, I wanted to take up orthopedics. I wanted to practice in Mumbai, but none of it is planned. So it's also about letting life take its course and putting you where you're supposed to be, and that I always feel you're at the best place at the best time. You may not realize it at that point of time. So, uh, keeping a watchful expectation and see where we turn up.
And like how busy you are in your profession. Do you have a work life balance? And what are the elements which help you keep this work life balance if you have it?
So yeah, work-life balance is quite good. I would say I'm in an institution which allows for that. Um,
You have your work life balance.
yes,
You think
yes,
you have.
yes, yes. So I mean, see, very important thing is when we talk about these things, I actually really love what I do. So there is no doubt about that. So it is when you are doing something out of a compulsion and not really loving what you do, then these stresses start to build up.
Right.
So for me, even if I have to do surgery 10 hours or 15 hours a day, I'm very happy with that because working on the shoulder or doing these sports injuries or arthroscopies is something I actually love. So it's actually more of a stress buster for me rather than anything else. So that is one part of the thing, but very, very important, as you said, it cannot be always work and this thing. So I mean, my wife, she is a very, very big support for me, and obviously there are ups and downs with your practice and the way work processes, and she is a very solid rock of support. My wife,
This time interrupting. Is your wife a doctor?
no, no, she is not a doctor.
No. So what do you think? A doctor should marry a doctor or not?
So my wife is a MBA. She works for a MNC. My both parents are doctors. So
Oh,
I've seen both sides of the story. So there is nothing right or wrong in anything. So what I've realized is if a doctor marries a doctor, then the hospital will also be at home and you'll be only talking about that. But if a doctor marries a non-medico, then you can talk about a lot of other things. Um, Doctors, as such, probably if you ask me, lot of doctors may accept it, some may not accept it to your face, have a very monotonous lifestyle. The other fields and professions have more varied lifestyles, and you get exposed to that. You have more fun in life, you explore new places. So, both things are there. So, over a period of time, if you look at couples or partners, they will understand each other's profession more well over a period of time, and there won't be a time where you will feel that okay, this part this person should have understood. They understand everything over a period of time, so that's never an issue. So, if it's totally your preference, if you ask me. If you
right,
want a
right,
so there are people who want a different point of view in life. There are people who are more comfortable with the same point of view, so it's up to the person.
right. If you could eliminate one thing from this world, what would you like to eliminate?
Really, if you ask me that one question, it would be colonialism, which happened to us maybe 75 years, 200 years back, and we got freed from it in 1947. That is one very important thing I would have liked. If that would not have happened, it would have really made an impact. We had nearly around 30% of the GDP of the world in India before the Britishers invaded us. They made us so poor that at the time of our independence, we contributed around 3% of the world GDP. From the feeding bowl of the world, we became the begging bowl of the world, and that is the saddest part. They took away $43 trillion, but it's not a question of money. The way they systematically destroyed the culture of India, that is the saddest part. And if you could ask me to turn back one thing, that would be it.
Right. Right. And I'd like to ask you what are the pros and cons of being a practicing doctor in India and being a practicing doctor in developed countries?
Right. So there are obviously advantages and disadvantages. I've worked at both places. So, if you practice abroad, you can have a better work-life balance, so to say. So, typically, the work starts there at 8 o'clock, and by 3 o'clock, they are done with their work. They go home, and on a weekend, it can even finish off at 2 o'clock. So, and you have Saturday and Sunday to yourself, so they can explore a lot of things. If you look at the United States, the salaries of doctors are higher, and in the Europe, it is more or less less than the US, but good. In India, also, you can get to the same level. That's not an issue. The money part is never an issue. You are in this profession because you want to do good for people, you want to treat people. That is why you are in this profession, actually, not to make money. So that is a side part of things. But more importantly, you get more time for yourself when you're practicing outside. There is a more structured practice, the way you see patients. So generally, a surgeon may see patients only when they have tried other modalities of treatment and they are going to undergo surgery. Whereas in India, it's more you start seeing the individual from the first time they start having the symptoms. So for the patient, actually, if you see, it is a better setup in India where you have a more direct access to the doctors as such. Um,
And you
Other
get
than
so many patients. So the amount of experience you gain, I think, in India, it
yes,
is not comparable to any other country.
yes, definitely. The amount of experience, the number of patients that are there in India is definitely more. And there is a more direct approach with the doctor for the patients. It's more easier for them. The availability is also not an issue. So, with regards to clinical work, you compare with anywhere in the world, the maximum clinical work happens in India. So, that part there is never an issue. And see, at the end of the day, you belong to this country. So practicing outside, it's not your country. The amount of comfort you have at your home, that can never be matched. And people are more grateful. There is more gratitude, and you love to do your work here. So that is the difference essentially. Um, Here, essentially, compared to working outside, uh, we have the same level of what do you say, technology, what is there abroad, same thing is available here also, and we need to use that technology carefully to give the best results to the individual. So every kind of thing which is there outside is available here also, and we have more number of patients. There is a more approach to the doctor. So, but compared to the West, your working hours are longer. Probably you don't have weekends off. So that is the only difference. But other than that, everything, most of it is almost the same.
And doctor, you have more male patients or female patients? Any such data? Maybe female
So,
have more bone and joint problems or male, something like that can emerge out from that.
mm, so if you ask me, an honest answer would be more. I mean, I think more women patients actually.
Okay.
Okay. So I would say maybe 60% are women, 40% are men.
Correct.
What is the reason? I don't know. Maybe they lot of knee patients are men, and lot of women come with shoulder related issues.
Right. And doctor, my last question to you is, what is your mantra which keeps you going with a bright smile and with adorned with a beautiful mustache and healing people? So, what is that mantra?
So, I mean, I just believe that, we just need to make the day better and start up with a positive this thing. What I always do is, when I get up in the morning, I offer my prayers and I wish my thank to the universe. It's very, very important to be thankful to, for being where you are and what you're doing. And, there are so many negative things happening in the world. If you focus on them, then there is no end to that. But then if you look at the positive things, then there is so much positivity also. So it's about attracting that positivity and getting up with a positive approach. Second important thing is when I get up or my wife gets up, no mobiles are allowed for 1 hour. We don't touch the phone. So digital detox, and that's very important.
Thank you very much, Dr. Aditya, for giving so much of your time to us, to my viewers, and I'm sure they would love see the podcast, they'll know so much information about muscles, joints, sports, and sports injuries. Thank you very much, and I wish you all the very best in future.
Thank you. Thanks a lot for calling me. Thanks for inviting me. It has been a pleasure talking to you, and I really liked it. Thanks a lot.